My name's Yoshi Lang. I'm a family medicine intern at San Francisco General Hospital, which is the UCSF family medicine program.
Hello, this is Anthony Flagg. I'm a CIR physician, and when I was in pre-med and medical school, I often wanted to stand up and be an advocate, be an activist, and I found it very difficult. A lot of folks going into medicine aren't oriented that way, and we just have so many pressures. But I want to encourage you today to stand up and get active.
Hi everybody, I'm Suji Hamilton. I'm a PGY2 resident from Kingsbrook Jewish Medical Center in New York. I'm a rehab physician resident. I love it. I'm reporting to you from the CIR convention in Philadelphia. It was very exciting. We learned a lot of new things, and we're on our way to making some changes.
Alright, that's enough. For those who don't know me, my name is Jay Bott. I'm an internal medicine resident at the Cambridge Health Alliance. And for me, dance is a way that I bring people together. For change, for culture, to bring people together, to be motivated around different issues, or just to have fun.
At medical school at UCSF, I was very involved in the local AMSA chapter, and also spent a lot of time working with physicians for a Democratic majority, and we spent a lot of effort trying to get Kerry elected back in 2004. And since then I've been working a lot on primary care policy and advocacy, trying to look at why not enough students are going into primary care and doing research and advocacy around that issue as well.
In medical school, I was active in a few different fronts, a lot of AMSA activism, specifically on the issue of farm-free, which is removing the undue influence of pharmaceutical companies from medicine. Also activism on universal coverage in terms of healthcare.
For me, when I was an undergraduate at the University of Chicago, on the south side of Chicago, that's where I saw inequity across a number of arenas, particularly in healthcare, and that's what drove me to get involved in the kind of the community change work that I now do as part of my life. I got pissed off. I got upset. It hurt me to see the kind of situation some of these patients were in. So I've carried that through my work with the American Medical Student Association, with the American Public Health Association, with CIR now as a resident, and it's become an important part of my life.
I think what I'd want to say to physicians in training is, number one, the importance of seeing the activism, the bigger world changes that you're working for as part of your education, not as something to be added on, and definitely not something to be dropped.
Advocacy is one of those things that you're going to be doing as a physician, as a medical student, as a physician in training for a long time to come. And thinking about putting that in the context of an issue or that you're upset about as it relates to something going on in the world will help you make an imprint of it as part of your life.
I think the hardest thing is taking that first jump. A lot of folks just say, I can't handle that with organic chemistry or with gross anatomy, and really the truth is the students that have just the courage to jump into it find that they know more about what it is they're going to do, and know much more than if they just stuck to organic chemistry and anatomy as their education.
When you become a resident, things change. You start to work. You start to really feel like you're a physician and that you can make a difference. And here at this conference, it's a part of the CIR, it's the Committee of Interns and Residents. So it's your place to really shine, to fight for what you need, and to support others as a group. There's strength in numbers, and we can make a difference. You'll find out when you're a resident that duty hours mean something in your contract. You want someone who's going to be a voice with you, a strength with you, to be able to fight for any changes that need to be made.
I think what I'd want to say to physicians in training is, number one, the importance of seeing the activism, the bigger world changes that you're working for as part of your education, not as something to be added on, and definitely not something to be dropped. we as physicians in training, including pre-medical, medical students and residents like myself, have the ability to speak in a way that many of our patients in our communities don't. We're listened to. Wearing that white coat, doesn't matter if it's short or long, gives you a real trust.
Right now is an incredible time to get involved in healthcare reform. Something very important will happen by the end of this year, and our voice is all too important not to be shared. So I encourage you not to lose context of your work, to be trained as someone in medicine that could take care of someone clinically, but also someone that could advocate for that patient on whatever issues that matter to them, but also someone that gets pissed off about something and then acts on it. You may seem overwhelmed, but if you sit back and break it down, use some data that you find to advocate for your issue, that'll go a long way in helping you create policies that then relate in effective change. So I urge you to get up and get out there and get in it and take care of people and advocate to the best of your ability.
I'd like to say to doctors in training, make activism a part of what you do, never, of course, at the expense of not graduating, not passing classes, but it has to be something that at a very early age you see as part of what it is you're going to do in health and healthcare. And I see most of the folks that have decided that early in their training keep with it, and those that didn't, by the time they get to become residents, just don't have the time or are even more kind of intimidated by the whole process. So get involved early. Thank you.
There's amazing groups out there like AMSA and SNMA and CIR for residents. So to plug into those organizations, to use their tools and the staff that are available to you to help, and then also to build coalitions with your fellow colleagues and to not do things on your own. And then you got to learn how to delegate, so you're not doing it by yourself. Those are my tips. Good luck.